2, 1, go.
Hi there, a bunch of you asked me for some treatment videos, so if you're one of those people, this video is for you. I'm Dr. Megan Von Holtz from Advanced Rehab and Medical, and I'm joined with my head receptionist today, Chrissy, and I'm going to do this today because poor Chrissy has some ligament damage in her neck, so it's really easy for me to show you a before and after that will be easy for you to see the differences. So whenever patients come in to get adjusted, I always do some quick posture checks. So if we just look at her posture from the front, then I'm going to have her lean her head back, straight backwards for me, just the best you can. Can you see when she does that, how she, without even realizing it, leans off to that right side, come back to the middle, and then you're going to keep your eyes closed, turn your head to the left and the right. So to me, she turns further this way than this way, but in order to do it, she has to cock her head forward. So in general, we can say she's definitely not moving normally. And I already know from treating her that she has some ligament damage at the second bone in her neck. So I'm going to work on that, and I'll show you that. Go and lay on your back. So this is our adjusting table, and the great thing, it moves on its own, so that's great when you come in and you can barely walk. Now I will tell you too, since Christy and I have worked together a long time, I'm going to be honestly more forceful with her than I would be with anyone coming in the first time, but I have known through practice that if I don't do it that way, we're not going to get the results from her, because her muscles like to pull back with a lot of force. Just relax here. So this that I'm using, it's called a negative Z. It's a piece of equipment from Pettibon, and I'm putting it really almost right at the base of the skull, and it's just going to drop. So she's going to tuck her chin for me. Just relax your shoulders. And I'm going to push straight down. I'm going to have to do it a couple times. Lift up a little bit higher. Okay. Just to make sure we get it moving. A little higher. Now we're going to get the lower part of her neck, lean all the way back and turn right. I'm just going to stretch that so that just dropped on its own. And then this time, like I've talked before, I'm going to distract. I'm just going to pull straight up. Try to get some space in that lower part of her neck. Good. And then lean your head back down, turn left, and just let that drop. So I know the noise sounds terrifying, but you can see that this is really not bothering her. She's just kind of laying here. And she's not, none of her muscles are contracting against it. This is the one that's always stuck for her, so we got to work a little bit at it. Okay. Ooh, sorry. Okay, we'll bring her back up. Hopefully, we will be pretty close. Alright, Christy, just kind of relax and then try leaning your head back again. Don't think about it, just lean straight back. Okay, we're not quite better there. Close your eyes, turn your head to the right and the left. So our turning is better, but our going backward is not. Go ahead and lay on your back. I'm gonna use the Y traction strap, and I did demonstrate that in a different video. So again, Chrissy's a pro, so I'm going to use a little bit more force than I do with other people. Just take deep breaths in and out. Now this part, I'm just a simple pull while she takes deep breaths in and out, tries to relax the muscles, because I don't want to do anything until they're relaxed. And I'm just distracting the discs and the joint capsules and the ligaments and muscles in here. Alright, take a couple more really deep breaths in and out. And I'm going to do a little bit of a quick pull to try to take the pressure off. There you go. Lift your head. And then let me just do some motioning to see if it feels more normal here. does, but we'll just do one other little quick trick. Let your head fall. There you go. Alright, let's see if we fixed her. I think we did, but we'll see. I never want to go without rechecking, because that's really what's going to tell us. Alright, relax your shoulders. Bring your head straight backwards. Alright, that definitely looks better to me. We might not be perfect. We probably need to do some muscle exercises. Close your eyes. Turn your head all the way to the right and to the left. So that's better too. If you remember before, when she turned right, she was kind of tipping her head forward. Turn all the way right. Now she can do it without doing that. So those are just 4 little adjustments that we did, and that's really going to decrease the pressure on her neck. Does it feel any different?
Yeah.
What do you notice different?
Before, it almost felt like I was standing like this, and now I feel release. I felt the release whenever you did the Y traction on my neck.
Wonderful. Sounds good. Thank you for joining Chrissy and I at Advanced Rehab and Medical, and we will see you next week. Have a great one.